Welcome to Southeastern Spine's The Age of Spinal Medicine mini edition. Today, we'll see a story of someone maybe like you whose life was limited by back or neck pain, but was able to get back to doing all that they love thanks to help from the experienced physicians and the latest medical technologies found at the Southeastern Spine Institute.
I had an annular tear as well as a herniated disc in the lower lumbar region.
Now you might be asking yourself, April looks so young to be having such a problem. And you'd be even more surprised to find out what she does for a living.
With being a personal trainer and understanding how important it is to have such a strong foundation with your core muscles and your back all together, I was surprised that I encountered this injury.
When it comes to young people having back issues, Allison was also concerned that she shouldn't be feeling old, not like her dad.
But I felt like back pain was for old people. I always heard my dad complain that his back hurt, but I didn't think that could happen to me.
We'll see later how these two young women found that the expertise offered at the Southeastern Spine Institute would help them get their active lives back and maintain their youth. But first, let's meet one of Southeastern Spine's oldest patients. Now, before she came to the Institute, Madge was having two problems: the pain in her back and finding someone who could help.
The longer the time went on, the worse I hurt. I got to the point where I could hardly walk. I kept going to different doctors trying to find somebody who would help me. Most of them said, I can't help you. One said, I can help you, there's an operation I can do, but I won't do it because of your age.
The Southeastern Spine Institute has been helping people of all walks of life for over 20 years. Here they feel that no one should have to suffer with back or neck pain, no matter what their age.
So when Dr. Johnson sat there and looked at me and said, yes, there's an operation I will do on you, and it would help you, I'm sure it'll help you. He paused, and I said, you aren't going to say, but you won't do it because of my age? He said, you're young and healthy. That's all I care about. I said, find you a doctor with sense.
Well, we tell people that it's more about the quality of life than it is about the length of their life. So quality is very important.
As far as Dr. Johnson's operation, I came back, no more pain.
She come out the hospital and I never saw nobody recover as fast as she did.
I may be 89 years old, but I expect to have some more good years.
Now that Madge is free of back pain, you won't be surprised by her answer when asked how old she feels.
Old, I think nowhere near 89. Nowhere near it. In fact, I look in the mirror and I say, who are you?
At the Southeastern Spine Institute, we're always here for you no matter what your age or when you start to experience back or neck pain. We like to think of it as offering spine care for a lifetime. Part of that care is not just helping you when you've sustained an injury, but being here when you first start feeling pain.
The earlier that we get that patient in to start treatment, the better chance we have of keeping them from needing to come back.
Once we have a clear picture of your exact problem, we are then able to help you get out of pain and often stay pain-free with non-surgical objectives like core strengthening exercises or simple lifestyle changes.
He took a look at my MRIs and just was extremely informative in showing me where my pain was and then going over options of how to deal with my pain.
I educate the patient on what their diagnosis is, because if they can understand what is wrong with their back, then they can make right decisions later in life when I'm not there to direct them.
Along with physical therapy, one of the things that was stressed through the different sessions was making lifestyle changes to accommodate the needs of my back.
Certainly there are ergonomic changes which can be made through your workplace where your head is in a more neutral position, which puts less strain on your joints.
I had my last treatment in March. Since then I have not felt the need to seek further treatment. I feel great.
It helped me out tremendously. The physical therapy that I received was amazing. It seemed to really help. And along with that and Dr. Paletti's care and doing my own exercises, I was able to shape back up.
Thanks for joining us. Tune in next time for another mini edition. You can watch full versions of any of our medical programs by going to southeasternspine.com and clicking Medical Documentary.